Hospital-acquired pressure ulcers, or HAPUs, are a major concern in healthcare today for patients, caregivers, and healthcare delivery systems alike. HAPUs are preventable injuries that cause many issues for the patients who develop them and cost healthcare institutions a great deal of money that will not be reimbursed by public or private insurances. Nurses are at the forefront of injury prevention within the hospital and can make great advances in inhibiting these injuries. HAPUs affect patients in multiple ways as they complicate the hospital stay and can create further diagnoses. This project focuses on the identification of pressure ulcers upon hospital admission and the identification of patients at increased risk for developing HAPUs. As stated previously, HAPUs cost healthcare institutions a lot of money. The Centers for Medicare and Medicaid Services reported in 2007 that Stage 3 and Stage 4 pressure ulcers cost $43,180 per case. Because Stage 3 and Stage 4 HAPUs are among the 8 preventable conditions identified by CMS, hospitals no longer provide payment for patients who develop these. Pressure injuries are more commonly seen in high-risk populations such as the elderly, bedridden, and critical care patients. Working on a critical care unit, this topic is of utmost importance. Hemodynamic instability, weakness, and limited mobility, and the use of vasoactive medications are all causes for increased pressure ulcer risk. And it is imperative to reduce the incidence of these preventable conditions to continue to provide the highest quality care possible to the critically ill patients on the unit. Proceeding with this Capstone project to track and reduce the incidence of HAPUs on my unit will help my own personal nursing career in many ways. In implementing this project, I will improve my interprofessional communication skills in addressing the different parties who will be involved in the changes proposed, and this will also provide me with an opportunity to advance the leadership skills I have learned throughout my bachelor's degree program. Completing and using the proposed changes in my policy will better my assessment skills as I will become more aware of skin changes in my patients. Executing this project will also create a connection for me between quality improvement and my daily nursing practices. Sometimes as a bedside nurse, it is easy to forget that nursing as a whole is constantly looking for ways to improve through evidence-based practice, and I can be a part of that. And finally, this will impact me personally as I can gain the fulfillment of knowing I am making even more of a difference in my patients' lives by completing this project. The nursing profession itself could also benefit from this Capstone project. Reducing the incidence of HAPUs, or identifying them early, will ultimately translate to a higher quality of care given to patients by nurses. Reducing HAPU rates will reduce length of stay and readmissions due to complications, therefore also allowing nurses to provide care to even more patients. This project will reduce hospital costs, thereby possibly allowing more hospital funds to go towards things to improve nursing, such as hiring more nursing staff. Although HAPUs are not solely the fault of nursing staff, many view them as being associated with poor nursing care. Reducing the incidence rates can break that stigma for nurses. Lastly, the nursing profession could benefit from this project as it reminds nurses that we make a big difference in the lives of our patients and within the healthcare community. Critical care patients are at increased risk for HAPUs. Providing high-quality care means to not cause patients any harm or prolong their hospital stay unnecessarily. This Capstone project will help to identify patients admitted to the unit already having pressure ulcers and will seek to identify those patients at most risk for developing them. All stakeholders involved, patients, caregivers, and payers, will benefit greatly from the reduced incidence of HAPUs, which cause preventable harm to patients and avoidable costs to healthcare institutions.